total abstinence from THC a solution?
I would say it is the textbook solution. How, in your experience with abstinence, how do people do?
Can be difficult.
It leaves some to be desired, right? Megan, have you ever seen, I'm sure you've seen patients go abstinent, but have you ever seen anybody, not go abstinent?
I mean, all the time, people continue to use.
Often they're not believing their diagnosis.
Right. Or that they feel like they can still continue to use low amounts
balance
and manage their symptoms that way. But for that is interestingly, one of the only published criteria for CHS is, that symptoms, if your symptoms go away after 6 months of abstinence, then it's likely that you had CHS 6 months ago. So, but it is, if it's like the presumed cause, then taking away the cause is likely going to be the solution. And I think that for some reason that pisses a lot of people off. Like, we're actually getting at the root cause of this, and they're like, there's no cure for it. Well, you take away the cause of it. Which is that's an interesting paradigm that I see, but yeah, it's that really is the only known thing to help with CHS. And it's recovery is a roller coaster. It's not like you stop using and then your symptoms go away. And stopping use can then trigger episodes down the line, and people are using their cannabis to stop an episode from happening, and then they stop using, and then it triggers an episode, or they have stopped using for a couple of months, and then they eat some food that triggers them, or alcohol or a stressful event triggers a CHS episode, and they haven't used in 3 months. So recovery.
Now they don't think they have CHS.
Right.
Because this dysregulation or this imbalance sort of lingers in our system for an extended period of time. Patients sometimes reporting 12 months before they feel whole again from a GI perspective. The damage and the inflammation that went on during their, and remember, people suffered for years without knowing, right? There are people on these discussion boards that suffered for 15 years with a condition. They'd seen every doctor, no one knew what it was, right? And they've been taking medicine and had all the scopes and done everything. But how did I get on this point, Megan?
Don't remember.
What you were just talking about.
Recovery.
Recovery being a roller coaster.
Right. So what I always counsel my patients on is patient yesterday hadn't consumed cannabis in 9 days, and she was in the middle of an episode, and it was triggered, at Disneyland from a hot burrito, a birria taco or something of this effect, right? And that's what set her off into this problem. So we don't fully know what the timeline looks like. We're going to ask you questions about this. If you take our survey or you send this to your friend, we're going to ask about how long after you quit did you have symptoms. But I can tell you in my personal practice experience, I am not a CHS sufferer, but in my experience talking to patients that have it, we're seeing easily 7 days, usually 21 to 30 days, and sometimes 60 plus days of, oh, I just had an episode again. Don't know what it was. Didn't know. Maybe it was stress, like Megan said. Maybe it was some weird food that you thought you could try again because it made you sick a long time ago, but it happened. We don't know, but we're trying to put that together so we can use that to educate patients, to help them know, because physicians aren't telling patients to, I shouldn't say any, most physicians are not telling folks that, hey, you might have more vomiting over the next few days. You should expect to have more vomiting over the next few days, even though I believe you and you quit 3 days ago. And that conversation is not happening because physicians aren't aware enough, or frankly, the data doesn't help them right now. There's not a lot of evidence for them to lean on and say, oh yeah, most patients will have another episode in the next 21 days. They don't have that information. So that's what, again, the survey is trying to give them some info to lean on to more quickly and definitively know sort of how to categorize and then how to treat, as opposed to throwing a label on something, throwing an antipsychotic to help get them out of the emergency room, and sending people on their merry way, which unfortunately happens more often than not.
Yeah. No, that's new to me. Like I said, I've done a few episodes on this and seen some CanMed talks on it, and obviously seen other things. I didn't realize that the roller coaster of recovery there. I thought, you abstain, your symptoms go away. It's really interesting that other things can sort of trigger it. And I mean, not that I'm a clinician, but my thought with that, and you could tell me if I'm on the right track, is, other things are interfacing with the endocannabinoid system, not just cannabinoids, and other things can kind of cause spikes in your endocannabinoids. So do you think that's perhaps what's going on? Like certain stressors, triggers can sort of just dysregulate
Yeah,
that
I'll hit
system.
on one point of that is that oftentimes people in recovery